What? Video. We're gonna just. Hey, Duffy. Wow, everyone's just starting to go in.
Hello.
Hey.
How you feeling?
Co-host. I'm doing good. I'm gonna get my video going. Okay, so all right. We could just start letting people in. Can you hear me okay?
Yeah, I hear you great.
Okay. Oh, we could just admit them all.
Did you get my text just now?
Yeah, I just admitted them all.
Sweet.
Welcome, everybody. Thanks for joining. We're just letting everyone in. Duffy, if you want to, you can take over with letting everyone in.
Yep, I got you.
Great. We'll get started here in a minute or two. We have a great group joining. Thanks again for spending your Wednesday evening for this educational Zoom. All right. Okay, just so everyone knows, we have about like 50 so plus people joining tonight, which is amazing because this is really to get, to really provide information on how community can be part of this process. So again, thanks for spending your Wednesday evening. We're just going to keep letting people in, and I'll get started probably in like 2 minutes, 5 minutes. Great. And we're just going to have to keep doing this. I have the agenda and I want to drop it in the chat. So thanks again while we let everyone in the meeting. All right. And I'll go ahead and post the let me get, oops. Just get everyone, and if I want to share my screen, let me just try that out while everyone's waiting here. Okay. Okay. Okay, that's me sharing my screen with you guys. Let me get my resources thing. Copy this agenda. I'm going to be sharing this little document at the end. But while people are gathering still, we'll start in a few minutes. I am going to put a little quiz up, and just bear with me while I figure out how to launch that. But here, let me drop the agenda. And then if people come in, feel free, if somebody wants to post the agenda again, that's just helpful with so many participants. Oh, that's not it. Give me just 1 second. Okay. Whew. I hope everyone's doing well this evening, and I'll do a little intro here in a minute. But here's the agenda. I'll share this document at the end, or even right now. I can just send this. Okay, copy, download. Okay. But everyone will get a copy of kind of just some of the resources I have, press links, just to kind of get everybody a little bit up to speed with what's been going on with the press. And just shout out to Duffy, who's letting everyone into the meeting before we get started. And then we'll start here in 5 minutes. Okay, I can do this. Let me not share anymore. Stop share. Okay. All right. Woo. Okay. We're going to get started in 2 minutes. 2 minutes, folks. And I'm just going to, here I got my quizzes. Right now, we've got just a pre-quiz for everyone. I just want to gauge kind of in the room, how much do we know about this process, the legislative process? Because that's really what we're doing today is we're going to give updates, yes, about Proposition 122. But before that, I really do want to share as much as I can without overwhelming everyone. You know, what is the legislative process? And we hear about a bill. So what are those steps? And I think that's very important as, you know, people are feeling really engaged right now and how to get involved. So I definitely want to, so before I start with my introduction here, in, what is it? 2 minutes, I want to launch this little survey. And it's anonymous, you know, it's just really before we begin, how familiar are you with Colorado's legislative process? How bills come to become Colorado state law? Please set, you know, below. And so, yeah, just would love to kind of get a feel of the room, kind of get us participating a little bit here. Trying to make this fun. And then it is, yeah, we're going to start here in a bit. I want to thank Duffy for just helping administer the room. And just so as like just sharing some of the results that are coming in, there's a lot of people here that are here to like learn, I believe, otherwise you wouldn't be here, also to get an update. But really, you know, it's true. We don't really know very much about the legislative process. I think that we were never really taught that. And that's kind of interesting too. I will say that and I'll do an introduction here in just like a few seconds, but I think it's important for us to know, especially since we hear a bill that's going to impact and implement Proposition 122, the Natural Medicine Health Act. And we'll just leave this up here, this poll up here. Okay, great. And then if someone can copy and paste the agenda, we're going to get started for some of the folks that just entered. All right. Well, I'm going to take a big deep breath. All right. Well, thanks for joining this evening. My name is Melanie Rose Rodgers. I'm a community organizer, an activist, and advocate. I care very deeply about the future of, you know, access to and, you know, rights to, you know, psychedelic entheogens. I care very much about that. I was one of 6 petitioners behind Denver's psilocybin initiative in 2019. So we started organizing in 2018-19. And prior to that, I was just someone that learned this process. I started going to the Capitol in like 2015, and that was really advocating for patients' rights. This is before, you know, we had adult use cannabis legalization. This was when it was just medical at the time. And so I think, and I have to say, we have done some really amazing things at the Capitol. We were able to do things like pass legislation to have medical marijuana at schools. And that really just sticks with me, that even something so, you know, stigmatized can be introduced and become law, where kids that need medical marijuana at schools can have them and can have access. And so, and I tell that story because our testimonials in this movement matter so much. And so as much as we're feeling kind of maybe, you know, things are happening so quick, or maybe we're a little discouraged, or maybe we're excited and we don't know how to get involved, your testimony and your action, and every single person on here, I really would love for you to feel, you know, empowered after this, that you do have a say in how we can keep this community centered, and how we can have our voices, how we can unite on our values to be able to make changes, as difficult as it was to add things like medical marijuana at school and some other bills that I've helped work through the legislature, and it just started just showing up, was adding PTSD as a qualifying condition to access for medical cannabis. And then in 2019, myself, along with some advocates here on this call, helped and expand medical cannabis access in the state to include autism as a qualifying condition, as well as any condition for which an opiate is prescribed. And so I've always just been an advocate for drug reform, access, patients' rights, access for, and then even now I was just at the Capitol testifying in behalf of social equity. And so that's just, as we talk about an equitable future for the future of psychedelic access and therapy and medicine. And, there's issues right now about equity. And so I just see this as, someone who's just seeing how, and I'll get more into that later, on why it's important that we kind of get informed, get educated, feel that we can have a say, because we do have a say. And so that's a little bit about like who I am. I'm also the co-founder of Expunge Colorado. We're a local nonprofit dedicated to access and education to pro bono record sealing services. So that's our part of helping with, provide actual reparative justice based on the harms of the war on drugs, which really impacted Black and Brown communities, Indigenous communities as well, just BIPOC communities, of who gets criminalized more so than others when we have legalization. And so that is another lens that I carry very much: social justice, racial justice, and always being doing what I can to help amplify the voices of the most marginalized and people that don't always have the seat at the table. And so I really think that's important, so that where I'm coming from in all of this. I have no special interests, no ties. I'm not going to create a licensed healing center. I was very much, vocalizing my opinions when Proposition 122 was being voted on. And I do want to say, I know there's just like people here and we all have different views. And I just want us, for the container of this is an educational offering. I hope that the chat, please be respectful. It doesn't matter how we voted last year on Proposition 122. And what really matters is how we can work together, how we can, if we want to, and if you feel called to, making not imposing that on anyone, that we have to work together, but we can. And in order to keep community at the very center of, this movement. And we know that there's, for some of us that were very involved last year, there was all this out-of-state influence and funding, and that's still present, that's always going to be present in politics. But I do believe we have a chance to be the change, be the change makers in this, keep community at the center, hold the campaign accountable for all their promises, is some of the values that I bring to the table, and that I really want to help, coalition build and really listen to the voices of people and the concerns and how we move forward together. So that is a brief introduction of myself. And so we are going to hold questions till the very end. Duffy is monitoring the chat, so because I can't be looking at the chat and also sharing my screen, which I'm going to do. But yeah, that's a little bit about me. I've lived in Denver for 15 years. I'm originally from Miami. I'm Filipino. My parents were immigrants from the Philippines. I'm the first one that was born here in the US and had to figure it all out. And so, yeah, just wanted you guys to get to know me, where I'm coming from, before I kind of provide this education to you all, and then also give an update on everything else that we're here today. So I hope everyone took the quiz, and but it looks like most of this group, we're here to learn, which is really great. And that keeps it optimistic. So, all right, now I'm going to jump into the basics of how a bill becomes law in Colorado. And I think this is just important. One thing is that we're hearing that a bill is going to be introduced. And before a bill is introduced, there's certain steps. And so I'm going to actually play just a really short video. It's like 1.5 minutes long, just to kind of give everybody a sense of all the different steps And then in my resources sheet, which I'll send in the chat at the very end, there's like a longer video from the state. So if you really want to nerd out and like get to know that, you can. But I think it's important that we just start with some basics of how a bill becomes law. And then also to just to ease everybody, I will throw this, and I'll mention this even more so, that before a bill is introduced, I've heard that we will be able to see it. We'll be able to see it before it's introduced. And so I think that just makes me feel better. That was a big relief when I heard that. So I just want to share that with you as we get into this. All right, let me share my screen. And again, thanks for joining. Share screen. This, share. I want to go with, okay. Okay. Can you guys see this? Okay, great. I wish I could blow it up, but I can't. I tried. But all right, let's get started. SB means the Senate. That's the year 21, and that's the bill number. And there's a hearing, committee hearing. It's assigned to a committee. Then there's the bill's second reading. And then this is where amendments can happen. And then there's a third reading. And it's a different day than the second reading. And then this repeats. If it starts in the Senate, it'll go to the House. And then there's like, yes, conferencing about it. And then it goes to the governor's desk where he signs the bill into law. Okay. So I'm sure we have lots of questions. Let me stop sharing. Okay. And so let's just kind of talk. I'm just going to talk that out of, so right now we hear that a bill is going to be introduced, and this was confirmed in the press about in February, and it's going to come from Senator Fenberg. Right now, we don't know the other bill sponsors, but that will be key as well for when we do outreach. But Senator Fenberg's office, so that he's a senator. And so it'll start in the Senate. So just like that process, a bill's going to be introduced. There's going to be a bill number. Right now, there's no bill number yet. So we're very much in the very early stages of this process, which is good, because I think a lot of us might have heard, who knows how far, and we can speculate and have our concerns and stuff. But right now, a bill is being introduced in the Senate, and we heard that was going to happen between now and mid-April. And I want to give a sense of like the timing. So right now we are halfway through the legislative session. The session starts in January and it ends in May, like 6th, really, which is a Saturday. And so we are in like at the halfway mark. And then also just some dynamics. I've been going to the Capitol. I've been running into some really great colleagues of mine, but there's a new Speaker of the House. And so there's actually like a jam with the like certain bill. This was just as of last week, but apparently there's a little holdup with how bills are being dropped or introduced right now because of new staff or new processes actually. And so just to give you an idea of what, I'm just sharing everything. I come from a place of transparency. And also, again, I'm happy to, if anyone wanted to reach out to continue this in dialogue, that'll be great too. I'm open to that. But that was like the basics of how a bill becomes into law. And I also want to share with you one bill so you can understand like how to like Google them. how you can like follow a bill. So once we do have a bill number that would implement Proposition 122, you can look it up. And so I just want to show you kind of my process. So if any point you want to look up where the bill is and how, where, you know, follow what committee it's going to first, and the amendments that will likely be introduced with the bill, you could read them all in one place. And so I think that's also very important. And so let me share my screen. Okay. Okay, so let's just start with, okay, like you can like just, I mean, I'm just going to walk you through it. So I'm looking for Senate Bill 23109. This is one that I'm following pretty closely, and I'll talk about that just briefly, and we can have another conversation about that. But so again, Senate Bill, so SB, Senate Bill 23 is the year and 109 is the bill number. We don't know the bill number yet for the implementation of Proposition 122 bill, but once we do, this is how you would find it. And then it would just come up right here at the top of your list. You can open this up and see exactly who I just want to show you. You can see the bill summary. You can read more. This is also on the right side who the sponsors of the bill are, so you'll know that right away. And they always want to try, when they talk about bipartisanship, there'll always be like someone from not only like Democrats and Republicans, but someone from the Senate and someone from the House. So like the senators are in the Senate, and the House, the representatives are from the House of Representatives. And then you could also see where in the committee this bill is being heard. So this is the Judiciary Committee of the Senate. It was heard first, and then now we see that it's going to the House. I'm not going to get too much into this, but this is actually, maybe I will. I think we're okay on time. This bill is something that I'm bringing forward to really the psychedelic community. I've been posting about in my Instagram and on social media, and some other key colleagues are also doing the same. But if you look at this, what they're trying to do, this bill makes it a level 1 drug felony if a person sells, dispenses, distributes, or otherwise transfers any quantity of a controlled substance or any material, compound, mixture, preparation that contains any amount of a Schedule 1 or 2 controlled substance. And I'll stop right there, because with Proposition 122, we just decriminalized 5 Schedule 1 compounds: psilocybin, psilocin, DMT, mescaline, not from peyote, as well as ibogaine. So this is something that's kind of like not on everyone's radar, but this is actually what people are calling a drug-induced homicide bill. So say, for example, I'll just give a scenario. I share mushrooms with Bob. Bob then has an accident, and or maybe he's feeling suicidal, and he either commits him, he like gets hit by a car, or he kills himself. Because I shared a Schedule 1 substance, I could be charged with a drug 1 felony. This is something that, like, if there's any people from the press, this is a really bad bill. This is actually, I mean, I understand the intention, which is that fentanyl is a crisis, and fentanyl's and all these things, and they want to like hold someone responsible. But everything that we just worked for with Proposition 122 is also roped up into here, because it says any Schedule 1 or 2 controlled substances. And just so you know, there was an exemption to include psilocybin, an amendment, and that got denied. And so this bill is still being heard. I'll drop some things in the chat later of how we can rally against that, and I'll send a follow-up. But this is where, like, I think there's some, like, even though we just decriminalize and legalize, psilocybin, and decriminalize, our 4 compounds, this is some really harsh drug, criminal penalties that they're starting to issue. And so yeah, that's just one bill. But see right here where you can't see, so it says it's been introduced. You can see the amendments. This is the fiscal note. So this is like the budget stuff, fiscal stuff. This is the committees. And then see, it was passed 3-2 in the Senate Judiciary. Here are the votes. Here's how people voted: 17 yes, 16 no, and that was the 3rd reading. These are some of the amendments that were won and lost. And so you can see just by looking all the different, the bill history, and also who the sponsors are. and look how many sponsors there are. So, and cannabis is exempt from this, but everything we just decriminalized isn't. So just bringing it to your attention, and there's still time. But one thing I find very interesting, it doesn't say where this bill is going next. Okay, so I'm going to show you just a really quick example of the social equity bill. The social equity bill, this is the prime sponsor of the bill, Representative, let me see, Representative Ricks. These are the committees it was assigned to. And then here's all the same thing. But here it says upcoming schedule. So we know that the next time that this bill is going to be heard, it's going to be in the finance. And then if you click on this, and it tells you the date, and then it tells you here the order of the bill and how it's going to be heard. So here it's going to be third on the list on Monday, 1:30, and the room number. So that's to just telling you, exactly when. But it is interesting that in the other one, like this, we don't know where it's going to be heard. And so one thing to note too, when you click on, let me go back. One thing, when you click on the finance details here, so that's actually not what I wanted to show you, but yeah, that's kind of it for like how to read a bill, how to kind of monitor it. So when a bill number is, you can always go here, type it in, or Google it. And then you'll hear about different committees. So next we know that like for example, this is like all the different House committees. So when a bill is introduced, it's going to go to a committee first. So it'll be assigned to one of these. And they're the first people that are going to vote on this bill. And then here's the Senate reference of committees. And what's really interesting too, and you can kind of maybe guess, like anything with education is going to go to the Education Committee. Anything about veterans will go to the Veterans Committee. Anything with budget, finance, and then appropriations, which I really believe this bill is going to eventually go to Senate appropriations. So I just want to, at some point, because there's budget involved. But this is just one way. I just want to show you, for example, let's go back to this social equity bill. It was in the House Finance Committee. So the House Finance Committee, when you go here, you can see all the members that are going to vote on this bill first. I really wish it said next to their names what county. But like, for example, like Junie Joseph, she's the vice chair of the Finance Committee. And if you click on her, you can get her contact information. If you click to her email, it'll show the email, so you can email, you can see what counties they're in. And so this is just really, and then you can see what other bills that Junie Joseph is supporting. So that's just one way of how you can contact. And again, I'm going to just stop sharing for a second. Oh, great. So one thing that's really important in how it works and how to have the best impact is that your state representatives want to hear from you and their constituents. So like if I live in Denver and I try to want to talk to Senator Fenberg, he's not going to want to really hear from me because he doesn't represent me because I live in Denver and he's out of Boulder. And so this is why also when you signed up, I asked, your city and zip code, just to kind of get a gauge of one, who's tuning in. And then two, if we are rallying against any sort of bill, we can regionally organize and we can pair up who should be talking to who on what. And then, so that was, the first bill I mentioned was Senate Bill 109. And so you would do SB 23-109 because 23 is the year, 2023. So that's something. And then back to why, legislators really want to get to know you. I'm going to drop one thing in the chat here. Let me just find all my stuff. Share it. Maybe if someone, oh no, I'll just do it. Hold on a second. I should have just copied my doc to my notes. Okay, great. Bridget, if you want to share just the link, do me a favor and please share the link of where to find my legislators. And you guys can Google this, but this is one way. Can we just do a show of hands? Maybe if you want to use the emojis, like how many people like don't know who their legislators are yet? Or maybe, yeah, let's do that. Like if you don't hear, like if you just like raise your hand, because then we're going to drop a link in the chat and you guys can get to know. Yeah. And this is why this is just so important, because a lot of people, again, just don't know this process. And so we're going to drop something in the chat here, a link where you can Google that. And then, but this is going to be super important as we continue community engagement and get to know who are legislators, and then know that they want to hear from you. It's their job, right? To hear from their constituents, and they represent us in the Colorado legislature. Yeah, thanks, Bridget. Bridget's an OG from my cannabis patient advocacy days. We worked on all those bills in 2009 to expand cannabis access. So thank you for that. And then, okay. All right, now I'm gonna, where is the chat all of a sudden? Okay, there it is. All right. And then I'm just gonna quickly just touch on why this citizen-led action is important. So like I had mentioned in my origin story, I've just watched how when you have a regulated industry with, let's say cannabis, 20% tax goes to the state. And then you have patients' rights, and for the medical side of the industry, there's not a lot of, there's no tax revenue, or very little. Maybe there's like, fees and fines, but there's no taxes. So then you can see how once there's an industry collecting all this tax revenue for the state, all eyes are on that. That becomes the priority. Then we have things like the marijuana industry group, that represents the industry, represents corporations, businesses, those needs. But then you can see how patients' needs and consumers' needs and other people's like needs can get kind of not focused on, can really just become non-relevant anymore once we have like a booming industry. And I kind of foresee that happening with the legalization of these access centers. These natural healing centers, is that it will be generating all this tax revenue. And that's where, us right now trying to start like a community centered and a Colorado centered, we're aware of, like the funding and the influence that happens when, especially, we know that $4 million, about that much, was part of helping pass Proposition 122. And I was very much a critical voice in that, because, investment 101, if I'm investing in all of this, I'm going to want to have some say. And so, and we see that kind of also in Oregon. And so it's just something to be aware of, something to know that could, can happen. And that's why really, in order for us to have our voices and our concerns at the table, we really do need to unite on a community-centered front. Okay, and that's why it's important, because when I look back at cannabis legalization, patients' rights, little by little, medical cannabis is dying in the state of Colorado. There was a bill, House Bill 1317 in 2020 when that passed, and that was very detrimental to patients. And it made things harder for doctors' offices and clinics and businesses and patients. It really was detrimental to patients. Bridget, if you want to, feel free to, write something in the chat about what that's like, as Bridget is a patient advocate and a patient herself. And I just, have seen this where, and then even now, just to paint a picture, social equity, like I had shown you the social equity bill, there's Black and brown folks that can't participate in the 10, 15 year legalized access in the regulated use in the adult and 21 market right now. We have delivery, but it's not working out. And I keep hearing how people of color, social equity applicants can't succeed in the framework. And guess what? They were not part of the rulemaking when legalization happened. So I use this as kind of like when people say, let's treat this like cannabis legalization. I'm like, well, then you should know that social equity was an afterthought. And even right now, they can't compete and can't enter. And that is something that I find like really devastating and wrong, and what we can learn from, right? As we move forward in this now new, what's going to be an industry. Don't really like the industry term, but it's inevitable. And so that's one thing. We are going to save questions at the end. And I'm still on track here. And we're about to just dive in to the updates that we know. And I'm, again, going to share everything I can with you, what I know. And that's really, not a lot, because we don't have a bill number. We haven't seen anything. And so, yeah. And then one last thing I wanted to say about social equity. Oh yeah, so I was in the hearing on Monday. And so you have like the leading cannabis law firm, Vincente Cederberg, or no, not even Cederberg anymore, Vincente, they pride themselves, they wrote the rules for cannabis legalization, they wrote Amendment 64. A lot of the lawyers involved with Proposition 122 say that, and it's true, they did write the rules for cannabis legalization. And then I just want people to remember that social equity was an afterthought. And then, and I've asked, I won't say that. And then, so in the room for social equity licenses, and this is to, and this came forward from social equity applicants being like, we need this in order to keep the lights on, or our businesses are going to fail. And these, again, are majority Black and brown folks that were in the room on Monday night. And you had a representative from Vincente Strategies opposing the bill for social equity. Now that to me is just something like, I just like, and then so now I see them being like, oh, we're all for equitable access. And I just like call that out like, oh yeah, well, what are you doing to fix the access that, and like the fact that the industry has had 10 years and like to have a head start without social equity. So Amendment 64 was written and passed in 2012. It was implemented in 2013. Social equity didn't become even an issue until 2019. So 6-7 years after legalization was social equity even brought to the table. And so that's where I really want to hold these folks accountable. And I honestly believe that equitable access also means that people of color and that different voices are also at the table and building, and being involved with what our needs are. So that's my rant about social equity for right now. But it's true, just saying. Okay, so it's important. We all know why it's important, because if not, it could become this corporatized model and it could be super medicalized. Our rights to have, to be able to grow, our rights to be able to share could very well be impacted. Okay, moving forward. Okay, so now for the latest updates regarding the bill. So last week, we met, and Duffy and I met with Senator Fenberg's senior advisor. And I think this is really just Duffy, being a Boulder constituent, was able to have a meeting with his Senate, with his representative, and also for, who SPOR is in the community, just being an established group, also calling out concerns in the Denver Post, and then maybe Duffy's, well-written email and how to get a meeting. But because of that, we got a meeting and we learned the details, and we came in with questions, and it was a very short meeting. I mean, even today I had a meeting with Senator Bridges' senior advisor, and I had 30 minutes, and it's like, hi, I mean, like, how can we put everything that we want to say in 30 minutes? But we'll get to that and how that can happen, like with fact sheets and all sorts of things. But basically we met with, and we asked, we heard through the news, through some of the people on this call and their news, that a bill was going to be introduced. So it's true. There's a bill that's going to be introduced. The timeline is now between mid-April. And because of the way that the NMHA was written, this bill has to pass it, because then it will implement the NMHA. And so I'm already feeling from, the senators and the legislators, like they have like over 200 bills happening, and the fact that they have to come up with the framework, and we know what's happening with the advisory board, just being newly appointed and even how that went down. This pace right now that we're in it kind of reminds me of last year, being in a pressure cooker, having to develop all the rules and the framework. So it's uncomfortable for them as well. I heard there were 200 people that were interviewed for the advisory board, and the Senate and the senators and the rep didn't even get to meet them. They don't know. And then there's this like governor appointed board. So they kind of feel like, man, like they don't even know, and they're kind of just wrapping themselves on who's who in the community. And so I was able to kind of feel into that they're feeling a little just frustrated about the pace of how everything's going, and the fact that they have to implement a bill between now and the end of session. And we're again, and the end of session is May 6th, and we're halfway through and there's no bill yet. So even the pace feels, unsettling. And so there's also, as you've seen in some of the news, that DORA, and there was a lot of us that critiqued that about how DORA is going to have all the, regulatory agency and all the say, and they were the main ones, and we questioned that. Well, DORA, we heard that the bill is going to implement possible changes to remove some of the power from DORA to, could be the Colorado Department of Revenue or CDHPE, the health department. And so, and we saw that even in some of the news. So we can expect to see kind of a shift of shared responsibilities of this regulated framework to come, not just DORA as the only regulatory agency, but like perhaps DORA for facilitator licenses, and then the Department of Revenue for, or maybe it's DORA for, the therapist license and licensing for facilitators, and then Department of Revenue for like fees and fines and the fund that was also created. But we don't know yet. Again, I'm just like sharing a bit from my conversation. And so that's why the bill has to pass, is so that it implements the NMHA. Also that one good news is that we heard is that we're going to be able to see a draft. And right now they are rushing. I'm sure they're having stakeholder meetings. So that's just something else I want to mention about stakeholder meetings, is that so even now in cannabis legalization, there's stakeholder meetings like for social equity. So no matter what, at any point, I hope this stakeholder process will be very much more inclusive. I think right now they are feeling they're rushing. They don't know who's who to even invite people to the stakeholder meeting. I suggest that if you would like to be invited to the stakeholder meeting, the upcoming meeting, that you directly introduce yourself to Senator Fenberg's office and you just ask them to be involved, because they don't know who's who in community to actually be able to invite folks. And so, and then that's a way too to introduce yourself to your legislators and Senator Fenberg, who is putting forth this bill. He's the president of the Senate. And so that's kind of what's happening. And there's going to be another stakeholder meeting, especially after we see the language of this bill. What we know and what we've heard in the news is that it's true. There's a good chance that they are going to address the personal use protections of Proposition 122. I'm gonna just throw this quiz in the poll. I'm gonna just launch this little, oops, sorry about choice 4, but this is just the importance of protecting Proposition 122's personal use. I just would love to get a gauge of how we're feeling in this room about that, how important that is. And hopefully if that's important to you, then I hope we can continue this conversation. This is just one meeting to kind of get some education going, but there's going to be a follow-up and a call to action that I'll talk about later. But hopefully if you're very passionate about this part, because we know it's a risk, because we've heard it in the news, this is likely going to happen. And I think what we've heard them say is that they don't know, they're worried about mushroom cartels, and also interstate commerce. And of course, in any drug reform, they're worried about children. And that's also what Blue Rising, which is going to always be an opposition, I feel, to our, cause, is that they're always going to be like, children, how does this get in, you know, how do we keep this out of the hands of children? And I'll just give one scenario too, you know, talking when Duffy and I were talking with Fenberg's senior advisor, we're like, what are your concerns? She's like, how do we keep the mushrooms away from kids at the festival? How do we keep kids from getting access to that from the guy who's just going to be passing it out freely? And we said, hey, this is happening anyway, you know, like this has always been happening, and tried to kind of calm the fear rhetoric. And then we actually talked a lot about harm reduction education. And I reminded her, I was like, I'm a product of DARE. Like, because we've been so hush about drugs, and we've just told everyone to say no, look how far that's gotten us. It's hurt us, you know, detrimentally. We have now, you know, we can't freely talk about it. So I was like, we need to, you know, and then we actually also said, and I've heard this as a concern from the community, that who's going to fund this harm reduction public education campaign, you know, that we're asking for. And that's something that I think when we talk about this bill and amendments that we want to see, and if they're going to put budget to this bill, we need to ask and almost demand that there is funding for harm reduction education. So that's, you know, something I just want to share with you all about, you know, some of the concerns. So, and they're also, yeah, they call it, you know, trafficking. So they're scared of mushrooms going to Kansas and what that's going to do and how that's going to be in the news. And so that's what we know. And also, I do have some insight that they, you know, when we left the meeting and we just asked what else, she was like, you know, thoughts about like, yeah, social equity and keeping this diverse and inclusive. And so that's really important. You know, in the conversation, that's something that at least was shared, you know, something important out of Fenberg's office. So thoughts around like equity and diversity, and that the bill must pass because it must fund. And so likely we're going to see it in the finance committee and then also in appropriations, which then provides a fiscal note. So those are some of the committees that we can just start kind of thinking of who to get in touch with. All right, I've done a lot of talking. And now I am going to open it up to questions. Let me see. Okay, great. I'm glad everyone's talking. Okay, yeah. And thanks for answering that and Jazz's question that, yes, because of how the bill was written, they need funding and they're going to change things from the what we've heard from Dora. So no, it has to pass. And that no matter what, so before I begin with questions, just one more thing is that there will be room for amendments. We are going to see a version of it. And they also want some feedback. I think right now for some of us that are really charged with no limits, we need like a fact sheet with like statistics, because data helps always, of why limits are not the way to go. And it's not also, someone brought this the other day, that maybe we don't talk about limits, but we talk about recriminalization of personal use now that we, you know, it's been decriminalized. But yes. Okay.
So just to help moderate the questions portion, I see some hands coming up. Angela asked a question of ways back, so just kind of want to go in order how questions have been coming in. I responded to some questions in the chat, but let me just find her question really quick, and then I'll just call on people as I see hands rise. I see you, Ashley.
Okay, yeah.
But yeah, Angela's question was, who is the we that will be able to see the impending bill? Stakeholders and or general public, when would it be available and will we be able to object?
Yes. So just how I showed, once a bill number is introduced, you will be able to look it up like just by Google SB 23 the bill number, and you will be able to see the exact language of the bill and any amendments that are put forth. But sometimes amendments, just so you guys know, also happen like in committee. And so I want to say, we don't always get to see the amendments ahead of time. And Bridget, if you're still here, you can probably speak to that a little bit more. We are going to see the first draft of the language, that is for sure. And if there's interest in writing an amendment, I'm happy to, field how that could be a possibility, what it could look like. And there's also a process too of how amendments are drafted. And I have this in a resource sheet with the legislative process. I hope that answered your question, Dr. Beer, sort of, but you are going to see it, but we don't know what it looks like. And that's the vagueness. That's the honest truth right now. We don't know what it's like. It's being drafted. And that's why right now, actually, the call to action would be is if you have concerns or something you would like to see, as soon as we can get that on paper, we can like bring that in to Senator Fenberg's office until we know who the other bill sponsors are, because then that would be another direct contact that you can make with the bill's co-sponsor or sponsors. But yeah, it's kind of hard to say. We don't really have anything we're working out of right now. We just know that there could be personal use protection limits. Not that it would be outlawed, to someone else's question in the chat, but perhaps they might want to put limits in. And then two, yeah, the children trafficking to being some of the major concerns so far.
Just to tie that a little bit, as soon as we know where the draft is before it's put on the floor, we're gonna put it on blast everywhere for everyone to see. So and then I think since you touched on it and it was in the chat, and then we'll go to Ashley. Speaking to the personal use section and the conversation that we had with Mindy there, what she said in our conversation was that there would definitely be some introduction of limits in personal use to essentially, their position is the personal use section needs to be defined further so that law enforcement knows what to do. And currently the way that the law was written, and this was like a fraught issue during the campaign, is that it says the necessary amount is what is included in the personal use section, but doesn't define what the necessary amount is. So right now, law enforcement is the first line of judgment and discrimination and saying, well, that seems unnecessary to me, so I'm just going to arrest you. I'm going to take medicine, whatever. So the limits are already in the law. They're not numeric limits. There are limits to what amounts to unlawful sale. Selling medicine isn't decriminalized because it can't be. That would be legalization in a regulated framework, as far as I understand. But so that's essentially a limit. But what they're talking about is introducing numeric limits. So like limiting the amount that is allowed by the personal use section. Why that's such a problem and is not a solution at all, because it's just inviting police to as a solution. And I think everyone on this call hopefully knows that ain't it. Is even if the numeric limits they set are super high, they say like 200 or 500 pounds or grams of psilocybin or of all of the compounds decriminalized is the now allow the numeric limit. Police can't eyeball that. So a police will be able to look at any amount and be like, I'm going to have to weigh that. I have probable cause now because you have a medicine that is not fully decriminalized actually. And I have to see if this is the allowable amount. So I'm going to make an arrest. I have, the right to search. And of course, that's going to be most impacting more highly policed people, people with less privilege than someone like myself. So that we took the stand as strong as we did during the campaign because, many many people saw this coming. And when I say we, I just mean people who kind of called this part of the law out and in. And right now we need to really make the case a clear message that, you know, we have the same concerns. You know, essentially Senator Fenberg is really concerned about irresponsible commercialization, corporate and otherwise. So in a town hall, he was like, you know, we're kind of worried about mushroom cartels. Literally, that's the language he was using. But we know if we can grow, gather, gift, that makes the commercialization obsolete, because it's the stupid laws that make for the conditions for any organized crime like that. Just saw someone pop in and out. But so yeah, what we need to do is just, you know, advocate that the real solutions here are empowering community, education, harm reduction education, empowering the local organizations here that can build the support, the community support for people to be able to access not just medicine, but the support they need and know where to go. And that none of this should be criminalized. That's a little spill. And I don't know if you had anything you wanted to add to that, Melanie.
No, that's good. And I don't know where we are. I know Mike had his hand up for questions, but thank you for that, Duffy. And I know it's like, we don't really have a bill, we don't have drafting, but we're just getting this in front of your attention. And we could expect to see something, what we were told was before mid-April. And that makes everything so fast because session's going to end May 8th. So like, I would say probably in the next week or so, we would see a first draft of a bill. Okay, who else has a question?
Ashley. And
Ashley, okay, Ashley, go. And okay. You're on mute, babe.
Still muted.
Can you hear
Okay.
me? Sorry. Thank you. Thank you. Thank you. I really appreciate the space to point out something that I think is really important to this discussion. I actually talked to Representative Bacon today about the long bill. I've been at the Capitol multiple times a week, and we spoke about 109. And also I've reviewed the long bill, and in the long bill, $700,000 is allocated to implementation of 122. And so I would like to strongly disagree that this bill does not have to pass, because what's holding up this legislation is their need to pass the long bill. And that's what Representative Bacon was talking about today. She was actually my administrator when I used to be a teacher. And so we connected over that and had a really great discussion about her opposition to 109, which is awesome, but also that the long bill is holding up a lot of this legislation. And we can look at the long bill. It's available online. That's the budget. And if we review that, there is $700,000 allocated to implementation already. So it will have funding once the long bill passes. So I would like to strongly disagree with this bill needing to pass for funding.
Okay. And that's right. I mean, we don't know. And thank you for that. And the long bill is the budget bill, and that just dropped. And so that's great to hear that they have $700 for implementation.
700,000.
Yeah, that's what I mean. 700,000. 700 wouldn't do much, but yeah, 700,000. And then maybe the bill could just be, again, we're speculating, but the power shifting from DORA, because we know that's coming. So maybe it's not the budget, but maybe it has to pass because they're trying to remove some of the power from DORA to the Department of Revenue or CDHPE, which is the Colorado Department of Health and something else, the acronyms there. So maybe you're right, Ashley, and hopefully we can get more clarification once we actually see the language, instead of having to kind of figure out where this can go and speculate. And that's kind of what makes this hard. But we wanted to have this conversation because things are just moving so fast. So we're just telling you everything we know. And thank you for that update. Ashley has been going to the Capitol every week. Thank you, Mike, Colorado Department of Health and Environment. All right, so who else has a question?
I saw Mike had a question, and also just to say to Ashley's point, what we understood is why it's highly likely that this bill will pass is because it's the highest congressional leadership. The president of the Senate is like the head, and if he wants to push a bill forward, he gets like the quick track to doing that.
Yeah.
That does not mean we shouldn't try to slow this down as much as possible and get in there and disrupt, and also build healthy relationships with the legislators, because we're going to need to be working with them for the long haul. And honestly, we have a lot of the shared concerns, and we just really need to educate our legislators. It's just to kind of, why we're saying that is just to give people like what the context is, that because it's the president of the Senate pushing this forward, it's highly likely that whatever it is, whatever the bill ends up being, it's probably going to pass.
Right. And it could be also amended. So even if it's introduced, there could be amendments where whatever is introduced, it's not always like as is, as it was written. So again, just giving some people some, hope that we would be able to either provide amendments, maybe strike if they were to introduce limits. And we won't know until we see the first language. But anybody else have a question?
Mike, I saw you had your hand up earlier. You still have a question?
Yeah, I just have a quick question about contacting our legislative representatives. Is that something worth doing at this stage? Or should we wait until?
I think you go. I would say go ahead. Sorry, Mel. That's your role.
No, I say just right now, as like they're gonna see it, and they get lots of emails, you guys. If we even get an email back, or even meetings, it's been really hard. And there's like a bunch of other bills going on. I'm tracking a couple of them. I'm going to share with you all. And then but they have and then really controversial ones. There's like 4 or 5 gun reform ones right now, which I'm actually in support of. I'm sorry if there's any like gun enthusiasts on the call, but there's a bill right now to ban assault rifles right now, like ARs. And I think after, just what we've experienced here in Colorado and in the news, that's something important. So I'll be sharing just a follow-up, but just showing like these are just like a short list of like all the bills like I'm kind of like tracking that I need to put somewhere else. But there's like tenants' rights, fair work week employment, equal pay for work. So there's a bunch going on. And so I think what sometimes you get is, well, that bill isn't being heard right now, so they can't get back to you. But I think just an introduction to your legislator is always helpful. Again, they represent us. And so just telling them who you are. And even if you wanted to say, there's going to be a bill from Senator Fenberg, that's going to implement Proposition 122. And I care very much about these issues. I would like to follow up once there is a bill number. And so that just shows like you're on it. And like, hopefully when there's a bill number, we'll be able to have meetings and maybe even bigger stakeholder meetings. I dream of a huge, like room where we can like break out into groups and we can invite senators here. And I'll give an example. Like at one point I had a stakeholder meeting at my home, and we had Senator Chris Kennedy, or Representative Chris Kennedy, and then Dylan Roberts out of Eagle County come. And this was to talk about potency caps for cannabis. And this was like 2018. And so perhaps like that could happen, where they can actually like meet with us and talk with us. And I think that's going to definitely happen like as the years go by, because again, we're just getting started in all this. All right. Anyone else have a question? Jazz.
Hi, thank you for putting this together. Just wanted to clarify, I saw in the comments, somebody asked if the personal use section might be outlawed. From what I understood, so far, no one has spoken about it like being completely nixed, and it's mostly about implementing limits, which we also don't want. But have you guys heard of people also being like wanting to completely remove the personal use section?
No.
At this time, no, haven't heard that conversation. And we don't know what this is gonna look like as years go by. And it's always just something that, hopefully never happens because it wasn't the will of the voters. And I think that's a very good point. Like if we're emailing our legislators to say, like, especially right now, like, we voted on this, please keep it intact as is. And if there's any changes to it, have it be a full, real stakeholder process, not like something that happens through when half of session, when like 60% of session is already, we're at that halfway or more than halfway mark right now.
Yeah, that's really important. I think it's still just important just to reiterate that why they're not trying to nix the whole section, but even the introduction of numeric limits, what we really struggled for is that police would not have discretion to determine what is the necessary amount, that should be up to people and communities. And maybe what can be like further clarified and we can like nudge them towards is just clear articulation of like what amounts to unlawful sale and what like are the illegal activities outside of personal use and the communal protections that we want to keep, and just educating them on why that's actually more towards a solution to the concerns that they have.
Thank you.
I saw, sorry, go ahead.
I had my hand raised, but I
Gabriella?
took it down. Yeah, and it's not really a question. Well, maybe it is, but I just want to bring, awareness. And I kind of had to step away from the space. Last year I was a little bit more involved because it was, really taxing to my health as an advocate for Indigenous people. And so, just that awareness that this is, like, historically, it was part of a genocidal tactic to criminalize Indigenous people from using their own medicines. That's why, they were Schedule 1 as highly abusive and no known medical benefit, even though, we've been using these for millennia. So yeah, in this space, and with folks here, I feel like Colorado is, a lot of people are here are thinking about reparations and thinking about how to make things right. So something that I'd like to do or just encourage folks is to, bring that awareness of like, hey, through this Prop 122, Indigenous people and caretakers of these lineages could be criminalized for, serving their own medicines to their own communities. Or, I think many people here have sat in communities with Indigenous people. So if you can advocate, for protections for Indigenous people, like, hey, we've been doing this for so long, and now we could, now police and Dora, whoever is going to be, the person that's going to be arresting or investigating this, will have an incentive to criminalize our people again. So not only will the medical corporate system profit off of our medicines and the exploitation, but now our own people will be persecuted. So I see this as religious persecution.
Yeah.
And yeah, it's about learning from history and learning how we can be better. And I just really, really want to bring that awareness that that doesn't continue happening through this piece of legislation.
Thank you. Mhm.
Yeah, thank you, Gabriella. Do you want to respond to that at all, Melanie?
I think she, just stated a very important point, and just, I would love to work with definitely amplifying this, when we meet with our legislators, if there's like statements we can bring from Indigenous keepers of this medicine to even like, present to them like written testimony, if, and there will be time within this bill for that, if people feel called to that, to come and have that, to say that in front of these people. And then something, because of COVID, we actually have, you're able to do that via Zoom. So again, as we just think of how we want to organize, and if you can't make it to the Capitol for when stuff like this is going to be heard and read, and it's our first time to actually come together to like address all the issues, I just encourage that if you feel called to testify and like put this on record, you know, that, and if you can't, then one of us can help bring it forth for you, because I understand there's sensitivity in that of just, you know, targeting and just, yeah, just, but I just know that I am willing to, yeah, definitely help amplify, you know, that concern, Gabriella, and your concerns and the Indigenous community's concerns.
Yes, indeed. Yeah, I really appreciate you speaking to that, Gabriella. We have time for one more question before we do the last little 5-minute close. Zach, I see your hand.
Thanks. Do you hear me?
Yep.
Yes.
Yeah, so my question is, like, as far as the limits go, what is a specific way that we could address the concerns of the legislators with like trafficking large amounts and having a limit? I think Feinberg mentioned, you know, the people who are possessing or growing should be able to know whether they are following the law or breaking the law. And so what is a specific, say, way to address those concerns that is not a numerical limit, so that it doesn't give discretion to the police, but that we can know for sure we're obeying the law and that those other things get addressed?
I think that right now we're all still trying to figure it out. I wish I had a much better answer for that. And I'll be thinking of that. And this is kind of where, as far as next steps, to dive deeper in some of these issues, I think this is a good, so I'm sorry, I can't really,
I could just really
you want to
brief.
go ahead and,
Yeah, just going back to, this isn't like a fully formulated policy recommendation, but also to what Gabriella was speaking to, because this is very sudden and moving very fast, we are put in more of a defensive position. Like right now, we want to just make sure we can say, respect the will of the voters, give this time for us to come together and actually build community and equitable stakeholdership in this conversation. And also we want to start getting proactive. We want to start ensuring that the protections for people, especially most vulnerable Indigenous people, especially, that we're not just sport or, some representatives here are just bringing that, but like Indigenous people are actually at the table bringing their concerns and needs, and that we should be given time for that, like really advocating for, like, if y'all want to embody equity and racial justice here, you need to slow the fuck down. It's not okay. And to your point, more specifically, like curtailing the conversation away from numeric limits and more, instead of putting guidelines around what people can and can't do, make it really clear what police can't do in the law, if that makes sense. So like police would have to see someone selling medicine, like have to see the direct exchange for money for medicine, potentially, for them to be able to engage in, like, what they do around unlawful sale. But as far as possession, people growing, like people can't touch that. So again, it's not a fully formulated policy recommendation. I'm not saying that's the right or the best way to go, but kind of like that direction is the direction that me, Melanie, and a lot of other people who've been thinking about this a lot are thinking about it.
great.
right.
And mindful of time, I think this is a good, and I just want to share that like 34 of us on this call think it's very important, about the personal use section as is, no limits. So just wanted to share that from the quiz. And again, so if you feel called, or even if like, you have ideas and maybe you don't want to get into the group setting because of just how things were last year, you're just not ready yet. Know that like myself and Duffy for sure are trying to gather everyone's concerns and ideas and trying to, even though there's the stakeholder meeting, we don't know who's been invited, we don't know who's attending. And then like there's going to be another one. Like I just really hope like you guys know that we're here to really keep things community centered and Colorado community centered, you know, here and really kind of keep the funding and the capitalism kind of out of this, and to really do what we can to help protect and amplify, you know, the needs and concerns of our communities. And so one way of getting involved is definitely because there's the My Coalition, and it's a new My Coalition. I know there was a My Coalition last year, and for anyone that went through that, it was definitely challenging in the time frame and in the times that were that. But this is a new My Coalition. Duffy, if you can, you know, drop that in the chat of how people can get involved. And I am really pleased to let you know that I've stepped up to be the policy and advocacy steward of the constellation within the My Coalition that's policy and advocacy focused. And the more people that we have and we can represent who's in our coalition, we can get really strategic and come really together with fact sheets and a united voice at the Capitol. So it's not just like every single individual person, you know, contacting their legislators. And so Duffy just dropped this in, and I'll do a follow-up with this as well of that. And yeah, so that is that. And then lastly, I'll let Duffy chime in, but I've got one more poll. You know, I just would love your feedback. We're really interested in kind of keeping this going, you know, like, because this is a statewide, you know, kind of effort and movement. And so we really do want to, so if you are in different parts of the state and you really want to, you know, bring a friend for the next one, we're looking to do this like every other week. And so just some feedback of if this was helpful would be great for me. Yeah, that's kind of it. You've got one more minute left, Duffy, if you want to say anything else that hasn't been said about the My Coalition.
I just want to give you tons of props and thanks. Thank you so much, Melanie, for showing up for this and preparing, and for being so devoted to not just the issues that I think most of the people here are like mostly concerned about, and you know, and like the world of psychedelics and medicine can get like a little myopic, but Melanie is so intersectional with it. She's really here to make sure that justice, and not just equitable access, but like actual equity and yeah, people power and community power is at the center of this part of the work. And it's really crucial for us to be able to be proactive and create the sacred economics that we need. We have to have the protections in place. So even if policy isn't your bag or something you ever thought you would care about at all, it's really critical that at the very least you support the people that do that part of this work. And Melanie right now is really like stepping up to lead there, and signing up, yeah, all the flowers to you, Mel, and signing up for the My Coalition, and kind of moving through the process of getting into our ecosystem. You'll be getting the updates and the invitations and the option to kind of like self-guide, choose your own adventure, what constellation you want to be a part of. Melanie's the first steward of any constellation. We're activating a whole slew of constellations because this is all happening right now. Really urgently, we activated this policy advocacy constellation with Melanie first. So Melanie's gonna host the first policy advocacy constellation. Should I not speak to that? I saw your eyeballs do something.
No, I'm just no go. I'm sorry. I'm just doing the part where I told everyone that I was going to drop my Venmo, and I feel funny about doing that. But if anyone
Drop the
can help,
Venmo, drop the
it's in
Venmo,
there.
please.
Any
Yeah.
donation is just because, again, just sharing all the knowledge I've learned, and just, you know, I don't know, trying to make things reciprocal in all of our lives. No one should be, you know, just like we're, you know, how it is. And I have been an advocate for years and years. And like, this is like the first time I'm ever, getting kind of, compensated for my time and knowledge. But it's not necessary, but thank you. That was my funny feeling.
Okay,
Keep going.
I totally get it. The money weirdness, that's such
Yeah,
a,
it's a
that's a
weirdness.
deep program. It's a tough one.
Yeah.
So yeah, the just wrapping it up, that we're in this short little window of how we're going to be able to rally the most powerful people-led effort to make sure that medicine are held in the trust of people and communities, not corporations. So the cadence is going to be like meetings with Melanie, these constellation meetings, then we're going to do update calls. And we only got like 3 or 4 weeks. So it's going to be like meetings, breakout, go everyone do the best you can and getting organized. And then, update calls. And then we are confirming the details on this, more info to come very soon. But we're going to throw a big banger of a dance/rally, just big like party, but also bringing people in to be able to engage and act and send a message loudly and clearly to the Senator Fenberg, I'm one of his constituents. He's in Boulder. So we're going to have this event in Boulder and do like a whole letter writing kind of campaign with prompts and stuff to send the message to Senator Fenberg. That's going to happen April 29th, it looks like. So like that the last weekend before the last week of this congressional session. So there's a lot up in the air. We aren't able to control how fast all this goes, but we know if we got an event ready to rally the people and we can really like bring people around that, and we will know what our actions need to be when we get closer to that time, we'll do the best that we can do. And then there's always next session, no matter how good or bad this session goes.
Right, thanks. And then I just want to be mindful of everyone's time. We're about a little bit over, but I'm just going to wrap it up in 1 minute. I hope after today you feel really empowered and knowledgeable in the process, because we do and we can make a difference. And I really just owe a lot of all my advocacy to the work that I've done with cannabis patients and seeing how, we were able to do some impossible things. And I think if we keep at it and we stay a strong, coalition, and if we keep things community centered, we could just be as big as some other entities that are in the process. As far as the advisory board, we can bring our own ideas as this thing develops. And so I just want people to feel like we got this. And it's right now how I see it. It's like we're all putting a stake in the ground, and that feels really good. To be at it early, to be on top of it rather than reactive. The next meeting, like the policy advocacy. So definitely check out the form and fill that out. We are meeting in 1 week, again, just because of the timeline. And I'm hosting that here at my home. And I know next week is Passover. And so if there's any big concerns, like there's a possible Tuesday, but again, we'll be meeting this and then possibly another call like this in like 2 weeks. So we're meeting in person and like kind of having a Zoom call like every once a week. That's kind of just kind of the time frame, but please feel free to definitely check out the My Coalition. It's a great way of keeping informed. And that's it. That's all I got. And again, thank you for your time. Thanks for going a little bit over with me. I hope you all have a really wonderful night. And thank you all for just spending this time with me as we go through this. And I hope it was knowledgeable and valuable to you. Moving forward. So thanks. All right. And then this meeting was recorded. I hope you all got the prompt. And let me know if there's any other questions. Thank you all for coming. Thank you for your acknowledgements, even in the chat and everything. I really, really grateful for all that. All your
Thanks,
time.
Mel. Thank you, everyone.
All right. And that's it. I'm going to close. Have a blessed evening, everybody. And we're stronger together. I just want you to know that. And please invite a friend, get the word out, talk to people. That's the only way, we can really kind of build this coalition and get community, other members involved. So thanks again. Have a wonderful night. I'm going to close out. Let me copy the chat. So I don't. Oh yeah, save the chat. All right, thank you so much. Good night.